All right, so now we're getting into repetitive injuries. Like we said, typically is that the acute injuries, repetitive injuries don't really affect the ligaments and bones. They're typically are going to be acute traumatic injuries, but you can have some overuse things if you're overstretching ligaments. Somebody has some laxity in the ligaments in their wrist, or some of the tendons. Ligaments can be injured by overuse. And then again, this fibrocartilage complex can be a repetitive injury as well. Rheumatoid arthritis, it's not really a repetitive injury per se, but it's in this section because it's really more of a chronic systemic disease. It's an autoimmune disease, so it's not really from overuse, but repetitive use of an area that has rheumatoid arthritis can add to it. So rheumatoid arthritis, it's an autoimmune disease where basically your body doesn't recognize the joint linings as part of your own body, and it attacks it. So it's a chronic inflammatory condition. A lot of times affects the joints in the hands. It can be a genetic condition. They're going to have pain with joint movements, gripping, weakness. They'll have some swelling of the joint, and then of course decreased range of motion to go with it. Right, so pain in the joint. So this is on the bottom of page 95 over onto 96. So you're going to see some of these other deformities here. And we have degenerative joint disease. We talked about this in other areas, and you can also have it in the hands and wrists. So basically you're going to see it with people with more wear and tear on their joints, either people that work with their hands a lot or geriatric. Now you can have, if somebody has prior trauma, let's say they've broken their wrist or they've broken their fingers and such, then they're going to be more prone to having degenerative joint disease as time goes on. Or it can occur diffusely. It's the same kind of thing when we talked about in the neck. If you look at the neck and they have DJD at C5-6, just at that area, maybe they had some old injury, they had some kind of whiplash injury. But if you look at it and you see diffuse DJD throughout the whole spine, then that's more just progressive, that something that occurred over time. So the same thing, if you see it in the whole, affecting the whole hand, that's more just a progressive thing over time. But if it affects just one joint, then maybe they had some injury previously that made them predisposed to DJD in a particular. Now hopefully nobody else will end up with their hands looking like that, but that's a pretty severe case where the fingers tend to ulnar deviate when you get arthritis with a problem. But basically it's just degeneration affecting the joints. So again, you're going to have stiffness, decreased range of motion. And when do you think they're going to complain of the pain? When do you think they're going to say it bothers them the most? Morning, and then what else? What's that? Yeah. Changes in the weather. If it's going to rain, barometric pressure changes, things like that. And then, I'm sure there's a Chinese medicine or something with, cold wind invading the spleen or something like that. Man, I'm not sure. I'm not making fun of it. I don't know that. You guys know all the right Oriental medicine, right? I studied that stuff before, but I could never keep it straight between if it's excessive qi to the liver or the spleen. What's that? Yeah, I know. Sometimes some of the stuff like this, you can understand it, but here it's physical forces on tissues that you can see and things like that, but other things gets more complicated. Right, now we're moving into contractile tissue. So again, here there's two things, like I said, we're going to talk about for repetitive injuries. You're going to talk about de Quervain's stenosing tenosynovitis. So like I said, here we're talking about these tendon sheaths. So if this is the tendon, it moves inside of this sheath that helps to lubricate it. It's kind of like a bursa. It goes all the way around it. So that's what we have here. Here's the tendon sheath, and then there's a tendon moving inside of it. And so here now we have inflammation. What happens is it gets inflamed inside of here, and it gets like kind of a sticky situation where it kind of catches it so that it doesn't move slowly. It doesn't move smoothly. So it almost gets to where it gets kind of like a creaky, rusty hinge, where you go to try to move it, and it's almost like something's binding where it's not moving smoothly inside of that sheath. And then they're going to have it in these the extensors and the abductors. So those are these tendons that go through the anatomical snuff box. Right, so then when we talk about special tests, we've talked about this before. When you do a special test for contractile tissue, what are the ways you're going to do it?
Active and resistant.
Active and what?
Active resistant.
Say that again.
Active resistant range of motion.
Okay, and then what else?
At the end of.
Stretching at the end of the range of motion. That's what this is. Like that. Okay? So you either tell the patient to do it, or you can apply force to it like that. So we're taking that tendon and stretching it at its end of range. All right? And I've never heard of a test for it, but if you were going to do an active resisted type of thing, you could just do something like this, right? Have the patient extend and abduct, extend and abduct their thumb and try to resist. So now they're contracting that tissue, right? So whenever you want to test contractile tissue, you either stretch it at its end of range or you contract the muscle. Right?
That's the Finkelstein test.
Yeah. But we'll talk about it later, but that just gives you a preview because you know you can the more you can understand it in terms of the pathology and understand the reason why you're doing it, it helps you to understand the test better. So again, it's going to be insidious onset, repetitive types of things. People are going to do gripping or things where they have to do a lot of thumb extension and abduction. Now, you get trigger finger, right? I guess it's if you're pulling your gun with this finger, right?
Yeah.
What happens is it gets, and whenever I've seen it, I've seen it usually in this ring finger right there, right? What happens is, again, you have that tendon that's going through some different sheets, and there's other like retinaculums and things along into the finger joints too. What happens is, for some reason, you get either a cyst or some kind of a bulging of the tendon. It gets caught, and then they'll say that when I grip my fist like that, and I go like this, it catches, and I have to go like this to loosen it up. It gets caught. Like it's like they're permanently pulling the trigger. They can't release it. Again, it's acute. Sometimes it can happen kind of suddenly, or it's going to be a gradual onset. But the basic thing they're going to say is that when I try to open my fist, it stays stuck, and I can't do it. It's usually going to be on this finger. It could be on any of the other fingers, too.
Is this also seen a lot of times post-surgery? Because we have someone that comes to our shift, and she had reconstructive tendon surgery, and they cut her open here and here, and that's the one finger that she still cannot extend.
Did she have it before the surgery?
The stuck finger?
Yeah.
No.
Yeah, it could be scar tissue.
Oh, okay.
You know, something that's built up that's not allowing that finger to extend fully, and it gets stuck.
Okay.
And I mentioned this in another class, I haven't done it yet, but there's some handouts that you can show patients to do. They're called tendon gliding exercises. And I think it shows it on here. But basically, you can see that there's more than one way to make a fist, right? You see the difference between, you just pay attention to all these three different joints here. Okay, it's the difference of making a fist like this versus making a fist like that versus making a fist like this. In this case, I'm bending all of those joints versus, doing this. Okay, and then you get into finger puppets, and that's a whole other story, right? But you can see that doing that, and if you're doing that, you're sort of moving the tendons a little bit differently. It gets them in different positions. So that helps to get those tendons gliding and things. Because if somebody's doing a repetitive thing where they're constantly holding the shovel and they're digging ditches for hours and hours, and all of a sudden when they go to take the shovel out of their hand, it doesn't come out of their hand. Their hand's like, So doing things to help. Again, it's that same type of thing. You have these tendons that glide through there. The more you can keep those moving and smoothly lubricated, the less likely you're going to have problems.